Welcome to Let's Talk Health. I'm Dr. Denothra Archer-Cartwright, and I'm here with Dr. Marvin Smith. He's the Deputy Director of Supply Chain Management Agency and the Chief Pharmacist at PMH at the Public Hospital Authority. Marvin is also the President of the Caribbean Association of Pharmacists, and he graduated from as a Doctor of Pharmacy from Mercer University in Atlanta, Georgia. Welcome, Marvin Smith, Dr. Smith. Welcome to Let's Talk Health. You are basically christening our first episode on YouTube. So thank you for being here today.
Well, thank you for inviting me. It's a pleasure to be here. I have a real passion for really getting information out there to the public. And so I'm really glad to be able to be here, and I wish you best on this maiden voyage.
I know.
Let's Talk Health.
What really struck me, Marvin, is you did a speech the other day at the Rotary Club, and you also spoke with some of the papers, and you were speaking about medical marijuana and really how do we go about dealing with this here in the Bahamas and here in the region. What made you want to speak on that topic in particular?
Well, I'm a member of the Rotary Club of West Nassau, and it's very rare that they invite their own members to talk, but this issue, I think, hits home. I'll give you an example. I had a member come up to me and say, this topic was so timely because my wife is dealing with dementia on Alzheimer's. And I read that medicinal marijuana can be used for treatment for this. I've had other people call me and email me and say, I'm glad you're talking about this because my family member went through this with cancer, or went through this with something else. And so for me, it was really important that we really focus on the medicinal use. There's so much in the papers and the media and some other things about decriminalization, and we're seeing what the region is doing. But I really wanted to put it out there that these plants have a purpose. Everything that's been created and put on this earth has a purpose, and has a good purpose. And so we go back to the story of creation, and it says that after the Creator looked down and saw what He created, He said it was good. And so even though we use some of these things for maybe some other things that we shouldn't, there's some good in everything. And so I really wanted to bring that to the fore as we really engage people to take more of a personal responsibility about their health.
Excellent. And that's what struck me too, because you were not speaking about recreational marijuana, but you were talking about medicinal uses, which is, I think, what we should focus on really, because I'm not really an advocate for recreational use. But I know as a medical doctor that most of the headways that we've made in medicine, we've always kind of based it on plants, and then we've been able to use those plants to come up with other compounds and to use that in a particular way. And there is a lot of talk right now about the different uses for medical marijuana. What are some of the things that you think, because there are some findings that are coming out now, they're actually doing more studies into it to see what uses are proven. What do you think about that, and what do you think that we'll find here in Bahamas?
I think there's some really exciting things coming about, and I really want to preface this by really agreeing with you. I'm not a proponent either way for recreational use of marijuana. I think that's a personal decision. Of course, the law itself has something to say about the use now, and for that to even be discussed, we'd have to look at the law being changed. Keep in mind that marijuana is a Schedule I, and so it's been identified as a product that has no medicinal value, and that's why it's a controlled substance. What I'm saying is that that designation, that categorization of it, was done years ago, decades ago. And as information changes, we should change. As we grow in knowledge and capacity, our understanding of things should also grow. And so I'm not going to get into the discussion with whether somebody wants to smoke weed, as we call it, on the block. That's something you got to figure out for yourself and with the law. But I'm looking at where research is heading. And the talk I gave the other day at the Rotary Club really was talking about the top 10 reasons for the medicinal use of marijuana.
Yes.
So one of the things I think we have to educate people on is that marijuana itself really can be broken into two major types of medicinal products. You have medicinal products that contain THC, which scientific, we call it the 9-tetrahydrocannabinol. All right? So we call it THC for short.
And this is really the stuff.
Right, and this is the stuff that gets the euphoria. THC is the substance that can get you, quote unquote, high. All right? However, we also have in marijuana these substances called cannabinoids.
Right.
We call them CBDs. These have medicinal values and do not produce the euphoria. And so when we look at why marijuana should be at least looked at as a viable option.
And it's the cannabinoids that really the receptors are in our brains.
Exactly. And so from our end, while there is use also for THC products, and we've seen that, all right? What I'm really promoting and trying to look at is that whole issue of utilizing the oils and the extracts that are found in CBDs, all right? And states as near to us as Florida already approved this. In Florida, you can get a license to grow marijuana for commercial use, but you can't use the flower. You can't use the pot we smoke. It's the oil and the extracts that they use. And so the first thing I try to drive home is that when we look at the long-term negative effects of marijuana, they are primarily associated with smoking THC, okay? And most of it is really because it's smoking. Right. You know, putting a heated vapor, a superheated vapor in your lungs is just not a good idea to begin with.
So is that why a lot of the products are moving to like oils?
You're seeing in oils and the vaporization where you don't get that super hot smoke and those sort of things. And so from our end, it is the smoking part of it that brings some issue. But even then, there's some positives to that. All right. And so what you have here is that's the first issue. The second part about it is that we do know that the use of THC has shown in some trials and some research to have an effect that impacts negatively brain development in young people.
And I've seen these studies where they've looked and they say up to even sometimes the age of 21, you can see these impacts on the brain of young people who are smoking, especially if they're smoking heavily. And we seem to have, an issue with our younger people smoking heavily in this community. And I think that's where it becomes controversial because we know that people are smoking it from a very young age. Are they going to go in there and find uses for the medical marijuana that they shouldn't be? It's a lot of things about the law and licensing this properly. It's a very tricky situation.
I don't know if it's as tricky as people make it out to be, and I'll tell you why. We have in our society now products that aren't even medicines that are controlled, they're regulated. So we know that alcohol impacts growing cells, brain cells, liver cells, kidney cells. And so we've realized that we don't serve alcohol here unless you're 18 or over. In some countries it's 21. There's a reason for that. It's not so much just the impact of alcohol in terms of getting drunk and some different things. It's also because physiologically, the body's not designed to deal with that level of alcohol use prior to developing certain organs. So if we see the same things in THC, then maybe this is something we need to control by age. I've seen some recommendations where as early as 21, they look at shutting off up to 25. And I would be more than happy to err on the side of caution and say we shouldn't have people exposed to marijuana, particularly in the THC smoking form, before the age of 25. All right.
We're seeing though, Marvin, in the Dr. Smith, in the U.S. that a lot of they're actually giving cannabis products to a lot of children.
Yes.
Seizures, neurological problems, disorders that have lots of pain involved, and that has also become controversial, especially with the fact that it does have these effects on a child. How do you mitigate that? How would you deal with that?
Well, I think we mitigate that like we do everything else in the practice of medicine. What's the best thing we can do that causes the least amount of harm? And so you take a child that has 300 seizures a day, and we're able to vaporize, or for me, my preferred recommendation would be the oil, okay? And we say, okay, fine. Yes, we may have some negative effects down the road, but if it helps to get that child to function and not have 300 seizures a day, you weigh the best possible outcome. We see the same thing in a lot of ways for some of the research that's coming out where they're treating veterans with post-traumatic stress disorder. And yeah, they're smoking it, but these men and women that are coming back from battle with injuries and mental issues are now being able to function more. So you weigh it and you look at the cost versus the benefit. What we've seen though is that our CBDs work. They work in a number of diseases, in cancer, because
I know the nausea, the vomiting.
yeah, well, not even just that. CBDs have been found to be a natural tumor growth inhibitor. And for those who may not understand it, what it basically means that when you introduce CBDs into the tumor, it stops a tumor from growing. It has that property, and it does that. And so you're looking at the fact that Alzheimer's, which is basically the production and the proliferation of plaques, in other words, scales on the brain, we see that CBDs prevents the formation of these amyloid plaques. So they help to treat Alzheimer's. They help to delay it. Nothing is going to cure it, but help to delay it. They help to treat the symptoms of dementia. We talked about seizures.
Right.
We talked about there's migraines.
But the seizures is kind of, there's different views on that. There's different studies on that. Some of not being totally conclusive.
Well, because cannabis as a whole, and particularly with CBDs, have what we call strain specificity, which means that there are different strains of marijuana plant. Those different strains produce different effects. Remember that marijuana is essentially a plant. Mm-hmm. It's composed of DNA, just like me and you. And so when the DNA is different, you get different impacts. The same way your DNA has you to be 5'5" and brown skin, and my DNA has me to be 6'4" and darker skin. And so marijuana is the same way. And so there's this thing called strain specificity. And so we have to look at not just what the studies are saying, but what strains are they using, all of these things. We know so little about this. We're just scratching the surface.
There's a lot more to be done. And then we also know that marijuana sometimes works differently with different people.
Oh yeah. You're talking about a drug that has an effect on the psyche, on the mental state of the patient.
Yes.
And that's even the ones that don't produce euphoria. Mm-hmm. All right. And so the metabolism of the patient's background, the patient's diagnosis, the patient's current health status. So we're seeing a lot of these different things. I'll tell you a very interesting study though, coming out of the Harvard's Women's Hospital in Boston. They're researching women in particular, but also men who are having problems anywhere from postpartum depression to anxiety to cancer, you name it. And these people have never tried marijuana before. And what they're doing is they're doing brain scans of them prior to use. And then they're testing brain function and doing brain scans. So we got a chance to actually see what your brain looks like actually on marijuana. And what they're finding is that, particularly for older patients whose brains have been developed, they're not seeing any real loss of brain function or cognitive function. And so it's very interesting. And it's strain specific.
So we've talked a lot about the positives, like any drug.
Yes.
And it is a drug.
Yeah.
What are some of the negative effects, other than, it's on younger children, that, we have to be aware of, because we have to, always balance everything?
I think the biggest negative effect we see in any kind of use, whether it's recreational or medicinal, is that right now it's basically being self-medicated. Medicines and medical treatment are complex processes. And I know this sounds strange to people. I talk to students all the time. I was talking to my alma mater at Bahamas Academy yesterday, and they said to me, "Why do you have to go to school for so long to be a doctor?" It's a fairly complex.
Are you kind of alluding that maybe these are toxicity kind of effects rather than just straight out side effects?
I think anytime you get a process in which people who have not been trained to study the body, how the body works, how diseases impact the body, you know what I'm talking about, physiology and then pathophysiology, and then the medicinal chemistry. So you study how the body works, how disease impacts the body, and then how the chemicals and biologicals we put in that body that's being affected by a disease work. Anytime you have laymen trying to do that, you're going to end up
But
with some adverse effects.
the initial, when they initially, let's say in the U.S., wanted to make it legal in some cases, one of the problems was really getting the concentration, the doses in a manner like, right now we can tell you to take 50 milligrams of this or 50 milligrams, and this will do a particular thing. Doesn't that seem to be one of the issues that we're having with?
It's a huge issue, and it's one of the reasons why, as an organization, the Caribbean Association of Pharmacists has been agitating and advocating across the region for research. As a healthcare provider, I want to be able to say when a patient comes to me, to say to them, okay, if you are going to use medicinal marijuana, you should be using this strain, at this strength, at this frequency, at these times.
Right.
The same as a physician, if you're going to recommend that.
Well, I would love to get to that point, and with me, I would prefer if we get to that point, then it's something that we think of. But I agree with you, and as a big part of the reason I wanted to talk to you, because you talked about research. I'm very interested in research,
yes.
And you talked about us being the lead on this in the region. What all were you meaning by that?
Here's the thing that drives the process of research. Remember that every research facility that has an FDA-approved process in the U.S. is getting their marijuana from the government site, which is pretty much, until recently out of Colorado, it's been the University of Mississippi's marijuana plantation. It's bad substandard marijuana. Okay, I had a phone conversation with Sue Sisley, who is the number one researcher in marijuana research in America, and she said the same thing. She says we'd love to do studies with actual real marijuana and not the stuff that's coming out of there. I believe that Bahamas, which has a climate and has the availability to have the best possible different types of strain. We're one of the few countries with different types of soil in different islands. Yes. Okay, we can access the strain specificity. We can have the research here. We can be the leader in this. The other thing is that, unlike the U.S. government, where it's a Control 1 and schedule, and you'd have to have a full federal recall, we already have laws in place that allow for the government to approve research simply by request.
So how difficult is this? Why aren't we pursuing this?
I don't know that we're not pursuing it. The government has said that they are in consultation. They're going to be they're going to take into account what the CARICOM initiative and research on this is.
Well, Dr. Sands so far has said that we're not taking the lead on this.
Well, I mean, I'm assuming that that's a statement of present day and not that we're not going to take the lead on it. This is something, obviously, that if it's going to happen, the government has to take a policy decision on it. We're understanding that the government has not had a full discussion on this. They're still in the information gathering stage. They're waiting on the CARICOM report, but I guess coming out soon. And by the end of the day, I think what you're going to have is our government, which our prime minister is a physician. We have a number of scientists and well-educated persons who have been involved in research, including the Minister of Health. I think letting the science be a part of their decision-making process is going to work for us. So I'm actually optimistic that as more and more opportunities grow and develop, and as more and more information comes out, that the wise men who sit in governance are going to be guided by information.
As the president of the Caribbean Association of Pharmacists, what is that group's stance on medicinal marijuana?
Our stance is really for science. Here's our thing. Our members are not pro-marijuana or anti-marijuana. What we want is, can we get information so that when our patients come to us, we can provide them with the best possible information. If the science comes out and says, look, as much as this thing works really well, 10 years down the road, it's going to be too big of a problem in terms of diseases developing later or whatever else, then we're going to be guided by the science. We're not driven to any side in this. Right. Our side is, can we get the science? And since here is something that grows indigenously in just about every member state within the Caribbean Association of Pharmacists, So we also realize that if it's there, and because there is strain specificity, there is a chance that there is something that grows in Antigua that will only be grown in Antigua, that can only have a way to develop and be used for treatments for that particular disease. And that would be great for Antigua. There might be something that grows only in Andros
Right.
that can do that. And so, we
And
want to.
do you think too, as well as we have a different kind of population from the U.S. and the other people who are leading in the study of marijuana. I've always thought we have to do things in the context of ourselves. We usually take that information and then kind of apply it to ourselves. If we now take this as a stance to start doing research for our populations,
And we should. And we should. You're talking about a plant that at its very core level affects and impacts metabolic processes. Well, we know that our metabolic profiles within the Caribbean are much different than I use this example in my talk on Thursday at Rotary. I love my Norwegian brothers and sisters, but their bodies process things differently than we do, all right?
and that's where the genetics
And
comes
that's
in
where
as
genetics
well.
comes into play. So we want to make sure that we're doing things that not just impact the global aspect of this use of this product, but the local aspect too, because our patients are local. So that I think is where the Caribbean Association stands. We want to make sure that we're providing not just information, but resources. Okay, because keep in mind that the only foreigner to ever have a patent and a drug study for marijuana approved by the United States, Henry Lowe, is a Jamaican. He's a Caribbean. Okay, and so we have people there. All right, we have people who have been studying this at the University of West Indies in Jamaica, at facilities in Trinidad, and we think that particularly now, not just in terms of the Caribbean as well, but let me speak as a Bahamian, all right, and as a proud alumnus of the now University of the Bahamas. There is no reason why at UV we can't be leading the way in this research, even if it's just retrospective, talking to people who have used it and finding out why and how they've been able to do certain things. So from my end, I think we're just hitting the tip of the iceberg.
And I think it's important to our community. I mean, I spent time up at Sandilands, and I see a lot of young men coming in with psychosis. You're not sure if it's the marijuana, was there something else in there? That would be a good point to kind of look and see, really, is it causing a problem with our young people in this community? So it's already affecting us, and it's something that we need to study anyway.
Yes.
And
Yes.
so tomorrow, the minister or the powers that be said, we're going to look into this thing. What is the first step that you should be taking?
Well, the first step is with any research. There are people out there who want to make this a commercial product, right? So when a drug company wants to make a product, a commercial product, they fund the research. Mm-hmm. There are people out there who would be willing to fund the research, okay? And I think it's a good opportunity to build and grow the capacity. The second thing is for us to have an honest discussion with our citizenry that says to them, what are your usage rates? What are the things you're using it for? How are you self-medicating? Why are you self-medicating? And have a real discussion with them as to what their use is. I'll give you a quick example. When our colleagues in Jamaica decriminalized, a year later they said, "Oh my goodness, the youth rates have gone up by 50%." Mm-hmm. My question has always been, did the use go up 50%? Or did the fact that it was now decriminalized, you found out that 50% more people that were smoking it behind the bush are now smoking it in front of the bush? And so we need to know truly what our real rates are.
So this sounds like some pre-study, pre-testing even before.
Oh, yes.
Get the data, get the information, and then we have something to compare with when we start our studies.
Yes.
And I think that approach makes sense because, like you say, you don't want to be looking back and be like, was this a problem before? Was it not a problem before?
Exactly.
Was it like this? Did the use go up? Is it an access thing? What is it that's causing these changes? And so I think that's very, very important, and you have to look at those things. Pre-assessment is always important.
Pre-assessment is important. The other thing too is when we do our pre-assessment, we're also setting what our standards are in terms of how we want to proceed, because again, we don't want to get the medicinal utilization or the possible medicinal utilization hijacked by this recreational use discussion.
Exactly.
Okay? I do a talk on addiction. One of the things I tell them in my research, we found out that the addictive tendencies of humans is something that is born out of the instinct, the very base of who we are.
Yeah.
We've always tried to use stuff. What we've done as humans is always try to make it stronger, faster, quicker,
Right.
better.
But it also, we have to have education in there as well, because a lot of people will say that marijuana is not addictive, it's a natural thing. I try to remind them that a lot of the drugs that we have now, they all came from natural plants, and
Yes.
somebody was using it, or and people were even addicted to it, like opioids and different stuff. They all stem
Exactly.
from some type of natural plant.
And what folk have to understand too, that addiction is twofold. There are substances that can create the physiological craving, but the addiction also has to have the person to be susceptible to that.
It's a lot, very psychological.
You and I meet frequently at a place.
Yeah.
Right? And we meet there enough that people might say, "Boy, they're addicted to that hot, steamy liquid." Right? But we may just like coffee.
Right.
Okay? But
I'm actually very moderate, so you will see that I come in, and then I think there's a lot of aspects to me in that place.
Right. So the thing is, are we addicted to the coffee? Are we addicted to the company, to the environment? See, so there's physiological addiction, there's psychological addiction, and then there's the actual substance creating a physiological craving for it. And so we have to look at all of those when we talk about marijuana and understand the personal one-to-one interaction. What is addictive for one may not be addictive for others, those sort of things. And so all of this has to be in the discussion. And what I say to folk all the time, are you not afraid that young people are going to do it? My take is, let's educate people. Let's educate people. If we can really show that marijuana has medicinal properties, one of the things that we can drive home to folk is, maybe this isn't something to use recreationally. All right? Because you wouldn't go and just take aspirin recreationally.
Right.
And so these are the discussions.
And the thing about it, with our population, if you tried to put some medication on them for anything, even hypertension, diabetes, they don't want it. But they will say, I will smoke marijuana, or I'll use marijuana every day.
Yeah.
And so it's the same type of thing. And obviously, if your body's craving it, if you want it every day, there has to be some relationship where it's affecting your brain and the way that you think and the way that you're acting.
Yeah. I remember in my first year in pharmacy school, one of my professors always said, everything has an effect, a side effect, and a real effect. You have to know that what those three things are, when there's a difference, and how to deal with them. And so from our end, we need to make sure that we're having a frank discussion when we get the science on this with people. But we got to get the science first. And running away from the science doesn't help us. It doesn't help us, particularly when the world is running toward it.
Yes.
Jamaica has already decriminalized it and has a cannabis licensing authority to deal with the production and research for medicinal marijuana. Cayman last year authorized that the extracts and the oils can now be imported and sold. Okay? Antigua just a month ago went to decriminalization and is looking again toward medicinal use. And we see it moving throughout the region. It's coming. Is the Bahamas prepared to stay in the back?
These guys are all going the other way. They're going recreational kind of first, and then, or decriminalizing and then research. But you're advocating the other way around, which is what I totally agree with.
Yeah.
And I think even if we seem to be behind, if we take this approach, we will be.
We'll be ahead. We'll be ahead. See, now there's a reason why I can advocate that. Unlike a lot of people who may want to advocate that, but don't want to do it publicly because they're afraid to be called hypocrites. I don't smoke marijuana.
Right.
I've never smoked marijuana.
And neither have I.
So I can speak about it without having to worry about someone coming to point fingers and say, "Oh yeah, but you smoke weed."
You just want it for this particular reason, you know.
And I'm hoping that that's not the reason why some of the folk that maybe need to talk about this are stepping away from it. Listen, I know for a fact that marijuana use in this country is widespread. I grew up. I grew up in a very, we'd call it the ghetto. Okay. And listen, I knew what marijuana smelled like before I knew what cream of wheat smelled like. Okay. So I understand that.
Right.
But we need to have an honest discussion and talk about these things. And I think, again, as long as it's being driven by the science, let the science own this. And that's what's important for us.
And I think that's an important point and a great point to kind of end on. I want to thank you, Dr. Marvin Smith. This has been excellent. What is your giveaway point? What do you want everybody to get out of this, at the end of the day?
Three things real quick. And I think this is universal to our approach as members of the Caribbean Association of Pharmacists and by extension the Bahamas Pharmaceutical Association. We want our people to own their health. It's your health, okay? And the best way to own it is to get as much information as possible. Secondly, once you get that information, what are you going to do with it? Don't sit on it. And then thirdly, understand that public policy, which is enacted by governments, really should be driven by the public.
Yes.
It's your policy. So talk to your MP, talk to your senators, talk to your ministers, talk to the people in authority. Come talk to us and say, do we want more information? We want to see this driven, or I agree with this or I disagree with this. But take an active part in something that can improve your health, something that is a social issue for us. And don't just sit back and let, I don't even want you to sit back and let us as scientists decide this. If it's going to be public policy, let the public have an input.
And let them educate themselves
Yes.
as well, because
Yes.
you don't want to go in there with just emotional views on something.
No.
It's up to you as a good citizen to get the facts for yourself,
Yes.
understand what you're advocating for, and so that you can go to your politicians with something that makes sense. You
Definitely.
know?
Definitely.
And so this has been an excellent talk with Dr. Marvin Smith, one of our head pharmacists, president of the Caribbean Association of Pharmacists. It's been excellent talking to you. This has been Let's Talk Health with Dr. Denothra Archer, brought to you today by Ashley's All Things Bahamian in Palmdale, as well as Cartwright's Electric. You can reach them at 376-7449. And if you want to reach me, Dr. D, you can reach me at 376-3911. Let's Talk Health. Thank you again, Dr. Smith. It was excellent having you. I think everyone has learned a lot of things.
Thank you for having me.
And let's get it done. I think we can. Once we continue to advocate for research and data, we will be the leading country on this. I believe we can do it.
Yes.
All right. Thank you.
All right.
That's the red button.
Yeah.